Hi everyone, my name is Takang and I'm a third year internal medicine resident at the Manatee Memorial Hospital in Florida. I present to you a research titled A Comparative Analysis of the Demographics and Outcomes of Hospitalized COVID-19 Patients in a Community Hospital in the USA from April to November 2020. Since being declared a pandemic in March 2020, COVID-19 continues to pose a threat to society. To date, Florida has had about 2 million cases of COVID-19 with over 30,000 deaths. While treatment and vaccination efforts have been promising so far, more information about COVID-19 remains relevant towards the effort to combat this pandemic. We aim to present a comparative analysis of the demographics and outcomes of hospitalized COVID-19 patients in a community hospital in Florida, USA. We therefore performed a retrospective chart review using our hospital database. All patients aged 18 and older who were diagnosed with COVID-19 between the months of April and November 2020 were included in this study. Our variables of interest were age, gender, race, length of stay, mortality rate, ICU admission requirement, and ventilation requirement. We first conducted a univariate analysis of all the variables. We then conducted a bivariate analysis comparing the outcome in patients aged 65 and above and patients less than 65. Lastly, we calculated monthly in-hospital mortality rate and ventilation requirement rates of hospitalized COVID-19 patients to get an in-depth view of our data. Comparison of differences were done using the chi-square test, and a p-value of less than 0.05 was considered statistically significant. For our results, Table 1 shows an overall description of variables. A total of 672 patients were included in our study, with an average age of 65 and an average length of stay of 10. Gender distribution was almost equal in this study. 19% of the patients required ICU stay, 12% required either invasive or non-invasive ventilation, while 20% died. Table 2 shows the outcome in the patients less than 65 years of age and in patients who were 65 years and older. 6.6% of patients aged 65 and above required intubation during their hospitalization compared to 4.3% in patients aged less than 65. Also, there was a statistically significant increased risk of in-hospital mortality among patients aged 65 and above with a relative risk of 1.5. Figure 1 shows the number of patients admitted, number of patients who died, and number of patients who required either invasive or non-invasive ventilation during their hospital stay on a monthly basis. July was the month with the most number of hospitalized COVID-19 cases. Meanwhile, highest mortality rates were noted in the month of April and May with 33 and 30.6% respectively. Highest ventilation requirement rates in the month were noted in the month of April, May, June, and July, ranging from 12% to 19%. The rate eventually went down after July and to as low as 70% in November. In conclusion, hospitalized COVID-19 patients who are 65 years and older have significantly increased risk of intubation and in-hospital mortality compared to patients who are younger than them. Both mortality and ventilation requirements significantly differ during the different months of the COVID-19 pandemic. This study highlights the higher mortality rates in people aged 65 and above and can help guide preventive measures like vaccination. It is also beneficial to inform decision making in case of another outbreak or in case of a peak in the COVID-19 outbreak. Thank you for your kind attention.